So how do you go about starting? Well, I learnt from Edward Whitmont that to change my approach to the patient. And most of us, I think in general practice, certainly will say, what can I do for you today, Mrs. Jones? And that's a very common opening introduction. But if you're actually looking to take a homeopathic history, I think what Whitmont does, and I certainly found it altered my approach, is to say to the patient, tell me about your problem. Tell me about your problem, and just let them get on and talk about it. And that actually produces a completely different set of symptoms and information from you. The patient will then actually talk to you about what is actually happening to them, and ask them to go through it with you and just let them talk. And what I do is actually to go through a system which is talking about the family history, personal medical history, social history after they've done that. But initially, your problem. And I let them talk on about it. And just listen and go, prompt it. Any more? Any more is a very useful question with which to elicit more information. And then you can write it all down. And I use verbatim comments, and I'll talk about the verbatim later on. I actually write down in quotes what they tell me. You obviously have the first few minutes as the patient comes in to make one or two observations as well. You can see whether they're nervous, you can see whether they're sitting on the edge of the chair, and you make notes about those objective things as well. I usually make a comment also about their physique and their colouring, and right at the top of my notes. And then once I've got all that history, I go back over each recorded symptom and stick to more detail, asking them specifically about heat, weather, time of day. And there is a set of things that we look for in particular. The sides, the times, the laterality, the aggravation, and the amelioration, and what started the problem, and keep on asking, yes, and what else, and what else. And that what started the problem can be very often grief, or loss of a job, or the birth of a child. I have a patient whose rheumatoid arthritis started the day she buried her husband. So what started it? What side is it? What time of aggravation it is? You heard earlier on today that arsenicum has a particular aggravation around about midnight. And if the patient's symptoms are worse around about midnight to 1 a.m., again, that's a clue to your prescribing for that particular remedy.
Why is side important?
Well, some remedies do actually, strangely enough, have a predilection for side. You'll learn, for example, that there's some of the remedies, there's one called lachesis, which has a predilection for left-sidedness. The opposite, lycopodium, has a predilection for right-sidedness. And some of the neuralgic remedies for facial neuralgia and even for angina have a predilection for left or right. And you'll find that in the repertory and in the materia medica of certain remedies. They are not 100%, but they're good guides towards that. You can find that there are some conditions which are so specific that you'll have it there, but others have a more broader remedy. Never take any particular one symptom as being the gospel for that remedy. It's only an indication. I mentioned verbatim recording. Verbatim recording is always extremely useful, and this is an extract from one of my personal histories, which is it's straight off the front cover. This teacher was married, and she was complaining of feeling cold all the time, and it's a family history, and she'd been investigated by various people who couldn't find nothing specifically wrong with her. But she actually says, I've always been cold, even as a child. My parents never believed me. My hands used to go numb and white, and they still do, and biting them is the best method of them getting them back. They go red. I had chilblains as a child, and hot water does not restore my cold hands. I have a deep sense of internal coldness, is actually how she described it. I get so cold I don't know what to do. I get cold even in hot climates in Saudi Arabia and in Spain. And sudden drops in temperature, I get cold and tense, and so on. And that is how I record those symptoms. Because when the patient comes back to you for the second or third consultation, you have the verbatim record to go back over and say, is it like that now? And that I find extremely useful. Another one, again, I'm sorry, it's very small, but again, it just says, I'm anxious and depressed about things. I often don't want to face people. I want to stay at home. I worry about senseless things. I castigate myself. That was the actual word she used for things that I should be doing. It's spoiling my life and my husband's. I cannot cuddle. I push my husband away, but that's not what I want. I want to go to bed. It's safe there. I often compose suicide notes in my head, but I wouldn't do it. I'm not a person to show my feelings. I've always hidden them, but I care deeply. I'm seen as very calm, but I'm so knotted up inside, it's incredible. That's the type of verbatim history that is extremely useful to go back over when you've given a case, when you've been given a case history. Even in my health service notes, and most of us will recognize this type of folder. This lady said, I examined her, she had a prolapsing cervix which was uncomfortable, and it feels as if the baby will come out. That's the thing, and you'll actually find that symptom in the Materia Medica and in the repertory. And in fact, I gave her Kali carb, which was the only remedy in the repertory for that. And the letter from the consultant says, thank you for asking me to see Amanda. She tells me that you've been prescribing something. Is it Kali carb? This has certainly done the trick. And she feels much more comfortable as long as she avoids intercourse. The cervix appears well supported. And so even in my health service notes, and this was a lovely one from earlier this August, verbatim, this chap had had an abdominoperineal resection and had a pouch formed above the anus. And he came in and said, my anus is so sore, it's like 1,000 needles. And I gave him Argentum nitricum, and in October the 25th, reported very successful, please can I have some more. So the use of the patient's own words can lead you to a useful prescription. Just a few do-nots in taking the history. Don't interrupt when they're giving that, when they're telling about the problem. The interruption disturbs their train of thought, and you get sidetracked. And if you can actually just keep them on track by not interrupting and just by making encouraging noises, you'll get more information from them. If you need to interrupt for any reason to keep them on track, just make a note and go back later. Don't ask yes-no questions, because yes-no questions are leading questions and will give you the wrong answers. Patients are always wanting to please you, and if you say, are you a hot person, you'll get a yes or a no. But your question should be, how does temperature affect you? How are you affected in hot weather? How are you affected in hot rooms? How are you affected by drafts? And let them tell you how they respond to these situations. And try not, at this stage, try not, and it's difficult, to ask questions which will confirm your hunch of a remedy. Because again, you will tend to ask leading questions, and you will get the remedy that you thought of if you ask the questions. If you're going to ask questions to confirm a remedy, leave it to the end of the questionnaire and the interview. There are two types of illness that we talk about in homeopathy, and it may only be maybe slightly appropriate to talk about them now. We have acute and chronic diseases. Now, many people say, and you'll hear it said about homeopathy, that homeopaths don't care about the diagnosis. Well, that's not true. Many people have this conception, certainly many doctors say, well, you only prescribe on symptoms. Well, that's true up to a point, but the symptoms are the pointer to the remedy. The diagnosis is still important. You need a diagnosis as a doctor or as a nurse to make a prognosis. So you must make a diagnosis. You must make a diagnosis using all the available information, and that information will include pathological investigations, X-rays, radiographs, everything. That is all part of the information that you need to make a diagnosis. And also, of course, some of the homeopathic remedies have such clear pathological results that, that the histopathology can give you the similar. Arsenic, for example, produces quite clear pathological results within the body. Cicale, which is the ergot of rye, produces pathological results within the body in terms of vasoconstriction and ulceration. And so reaching a diagnosis on pathological basis is quite appropriate, and diagnosing a remedy on that basis is appropriate as well. But in the acute case, the belladonna tonsillitis, for example, have you done belladonna, Russell?
We covered it in outline.
Yeah. Well, you cannot ignore the fact that the patient has a fever and has pathological tonsils or causing the fever, and that fever and its manifestations are part of the pathological process of an infection of the tonsils. So you approach the disease and look at the diseased patient with their fever and their red face and their dilated pupils and say, yes, we've got a chap here with a fever. Now, that's the diagnosis, and you know what the prognosis of that disease untreated is. But you also have an individual there behind that, and here you have to approach the disease, looking at the dilated pupils, the fever, but also the patient's response. And you treat that independently of the chronic state. And an acute disease is one which has a beginning and an end. The patient either gets better or they die. That is the definition of an acute disease in homeopathy. The chronic disease, on the other hand, is an ongoing state and may be reflected, for example, as an underlying constitutional state, which may bring on, for example, rheumatoid arthritis, chronic heart disease, chronic gut disease. And there, it's more important to look at the individuality of the patient and to treat the patient and through him to cure the disease. The symptoms of the actual disease are much less important. Here you're looking at the mental and general responses of the patient. Are they irritable? Are they weak? How they respond to the environment. And you treat the patient's individuality. And the remedy you may choose for that patient may not appear to have any direct effect on the illness itself. You're treating the underlying person. The symptoms in an acute case, which are important, are symptoms which cannot be explained by necessarily by the pathological process. and symptoms paradoxical to the disease diagnosis. Why should a hot patient, for example, who has got a temperature of 104, want to be covered up? You would normally expect a hot patient to be cool. So if you have a hot patient who wants to be covered, that's an important symptom. Symptoms usually of no use to the conventional diagnosis or prescription. I mean, for example, we'll go talk about the belladonna case again. Of what use are the dilated pupils of the belladonna case to prescription of penicillin? But if you see a hot, flushed child with dilated pupils, with circumoral pallor, heat radiating off them, with a fever and a throbbing headache, absolutely makes no difference to your conventional prescription. You give them erythromycin, penicillin, amoxicillin, but those symptoms are vital to the prescription of belladonna. Conversely, if you're going to give an aconite prescription to the child with fever, they're usually hot, but they're feeling cold, and the disease has come on very suddenly, like the belladonna one, but their pupils aren't dilated. And these are observations on which you must make your prescription. Symptoms occurring in other physiological systems at the same time. The occurrence of a diarrhea, for example, concurrently with another illness. It's, for example, in ladies in menstruation sometimes have concurrent diarrhea. That's an important concurrent symptom in another system, which is helpful in making a prescription. Alternating sore throat, I've seen that as well. Sore throat occurring in someone always when she menstruates. A particular nun I can remember, it was a very clear indication for a remedy which helped her, but which was absolutely of no value at all in conventional prescribing. Symptoms individual to the patient, and that was a particular indication. It was a highly individual symptom. And all these things: irritability, alternating moods, denial of illness. Somebody obviously ill and says, "No, I'm not ill. Go away. I don't need the doctor." There are a number of remedies in the repertory which actually do that. The need to move an inflamed joint. I mean, if you have an inflamed joint, functio laeso is one of the things that we learn, loss of function. But there are remedies in which the swollen joint, the inflamed joint, which is hot, is much better after being moved. And the time of day or night aggravation, again referring to the remedies you discussed, arsenicum has a nighttime aggravation about 12 to 1 a.m. and is very useful, for example, in somebody who has characteristically has asthma at that time of night. There are other remedies which have other times of aggravation. The kali salts, for example, have approximately 3 a.m. aggravation. There are remedies which are better always by day and worse by night. The syphilitic remedies, so-called, including for the dentist mercury. Mercury is a remedy which tends to have a nighttime aggravation. Thirstlessness in fever. Most people who are hot usually require and want to drink. Again, there are remedies which are cover thirstlessness in fever. These are paradoxical things and symptoms individual to the patient. And in these situations, when the patient says, "I feel," or "I am," or the mother says, "he is," then these are much more of value than my part, my leg is bad. I feel bad, or my child, he is always irritable when he's like this. These are very much more important. So for your acute case taking, you must make a normal clinical diagnosis and a decision whether you're going to treat allopathically. Because if you don't know enough about homeopathy, or you can't make a decent homeopathic prescription, you may be safer medico-legally and for the health of the patient to treat allopathically. It's an important decision that you must make at that stage. You ask and observe the speed of onset. Speed of onset is important in many acute prescriptions. For example, belladonna and aconite, some of the remedies you'll learn about very early on, come on very quickly. Whereas a gelsemium flu tends to creep on. It comes on over a few days. And so those are important distinctions. How quickly did it come on? And you look for objective and subjective changes in the thinking, acting, and being. Again, gelsemium tends to be a slow onset thing, and they're drugged, they're weary, half-lidded, whereas and they're lying there, you know, their minds go blank. When we talk about the ways of thinking and acting, being, we are talking about the way that the patient reacts to their illness. And these, for example, affect emotion. The patient may react to their illness with panic, anger, depression, and fear, cancerphobia. The panic attack can be, for example, an acute fear of death. They know the time they're going to die. They're definitely going to die. And this, the dentists will know about this. The patients who come in, they're sweating, they're on their upper lip, their pulse is racing, and they know that this is going to be the last thing that's ever going to happen to them. And this happens to people getting in aeroplanes. It happens with illness as well. And they become very fearful. The person who gets angry, on the other hand, has a completely different remedy. Nux vomica is a remedy that gets angry when he's ill and irritable. They retire to their cave and claws out at anybody who comes near them. So you have a different emotional reaction to the illness. The depression, though, some people become totally withdrawn and will not respond. And these patients become very depressed, and there are a range of remedies, for example, the natrum salts, the gold salts, which react to illness with depression, and they become involuted and don't want to speak to anybody. And then you have the people with cancer, with various sorts of phobias, cancerphobia. These are all, and they become, again, tremendously anxious. And they relate very often to the people who have the panic attacks. They're internally churned up, but they may not communicate it to you. And these are things you have to draw out of people. On the psychosomatic level, well, we have non-cardiac chest pain, functional symptoms, irritable bowel syndrome. And again, these are, again, the ways of thinking, acting, and being which are a response to illness or to environmental pressures. IBS and non-cardiac chest pain may be the result of a combined stress at work or within the family. And again, these are things you can draw out and you have to make a diagnosis that it is non-cardiac chest pain, and you may require to have ECGs for that. The pathophysiology of the patient may produce a whole range of symptomatology which will be useful in diagnosis. Sweating, for example. The mercurial remedies may have sweats. chills, fever, vomiting, loss of appetite, hyper and hypothyroidism and migraine may all respond to homeopathic prescription. But they are changes in the patient's way of being as a result of stress or a direct illness. And then you have the pathology itself, skin rashes, ulcerations, colitis, and peptic ulceration. And again, as I mentioned earlier on, it may be that the histopathology may provide you with information leading to a simillimum at a pathological level. Family history is important in homeopathy because you may discover a tendency to illness which runs through a family. And these relate to, more often than not, the chronic diseases. The chronic granulomatous diseases, tuberculosis, leprosy, not that we see that very often, but venereal disease. And you'll have lectures later on about the miasms as such. But a history of tuberculosis running down through a family in previous generations may give you a clue to a disease tendency in a child or an adult where there may be a tendency to have chronic sore throats, tonsillitis, glandular diseases, the chronic child with the chronic sore throats and glands, or maybe even a tendency for a child in particular to have a particularly stubborn trait and to be a very difficult child. Now that may be enough to point you to a particular remedy in itself, because that disease complex of difficulty in learning, difficulty in relating, being a no child, a child who says no to everything, coupled with that may be enough to point you in the direction of a particular group of remedies. But coupled with a family history of TB would actually give you a clear indication that that may be a remedy with which to start. The venereal diseases also, although very few people will admit to them, have a relationship to groups of remedies within homeopathy. And it's always worth asking, particularly about TB. The degenerative diseases, Parkinson's disease and dementia, neurodegenerative diseases, again are a group of illnesses in which in the past generations may give you a clue to a group of remedies which are known as the syphilitic remedies, because these are remedies which are associated with neurological disturbance. A strong family history of thyroid disease and diabetic and hormonal diseases in general, again points to another group of remedies. Atopic illness, mental illnesses would go with the Parkinson's disease and dementia, and cancer. All of these groups of family history illnesses are important in your history taking. Very important in homeopathy, and we always ask, when did it start? And very often the patients will tell you. And the symptom of never well since I had is extremely important. And the reason, and these, for example, the acute physical traumas, never well since I had that car accident, never well since I was burned, never well since I had that infection, or it came on when I got cold last week. Came on when I got cold last week could be could result in a prescription for aconite, the result of chilling, or for rust tox, for getting chilled when you were actually hot. You've just finished the race, the marathon or whatever, the London to Brighton run, and you got chilled immediately afterwards. Aconite and rust tox would be two remedies that you would consider for that. The results of trauma. physical trauma, the road traffic accident. And I was never right since we had that bump in the car or I got beaten up. You may very well consider using the remedy that would have been appropriate at the time. If you had a severe contusion or concussion, even a year or so ago, and you've never been well since, you could consider using arnica at the time. Or if it was something that you saw coming, you saw the car coming, skidding towards you, and it hit you, you had time to realize that you were perhaps going to die, then aconite, even a year or two later, might be an appropriate remedy. The person who's been in an earthquake, as in Athens, there was the earthquake in Athens in the 80s, people still, if they hear a rumble of a lorry going by, think the buildings are going to collapse. And that fear of the recurrence of fear which they experience is appropriate for opium. So these previous experiences are important. Never well since I had a particular infection. I've got 3 patients who've had non-paralytic polio, but who were left with symptoms of that polio 30 years on. And the remedy which helped each of those was the polio nosode. So made from the polio virus vaccine, which these things are available. Never well since burns. There are remedies that are specific for having had burns, severe burns. Carcinosin is a particular one, particularly if the child was burned. So these things are important in the etiology of disease. Never well since mental problems, indignation, anger, grief and fear. Well, I've mentioned the fear one, the fear of fear, aconite and opium. Never well since grief. There are a whole range of remedies in the repertory for the chronic effects of grief. Indignation, the person who's been dismissed unfairly or who's been superseded unfairly, can bring a whole range of things from irritable bowel syndrome to depression, skin rashes, psoriasis can erupt as the result of mental problems. And these things are terribly important in your history. What treatment did you have from conventional therapy? Again, a thing that comes on is said that is really a bad way of stating it. People talk about, oh, if you have conventional medicine, it drives the disease in. Driving the disease in is wrong. The disease may be suppressed and find another outlet. Asthma and eczema are 2 that we always talk about, but there are other things that can happen. If you have a disease which is expressing itself on the surface in the form of a rash, and you cover it with steroid creams or tar-based ointments, etc., you may clear up the rash, but you may find that your patient actually has another problem. And quite often in homeopathy and in herbal medicine, in acupuncture, you find that a patient had a rash as a child, but then developed asthma later on, or has an alternating set of symptoms, which as fast as you treat the one, another one comes up, or a bowel problem comes up. So what treatment did you have, and what happened as the result of it is again an important part of your history. General reactions. In homeopathy, we talk about the generals or the generalities, and we try to establish the typology of the patient. Now, Hahnemann and others have found that in the therapeutic trials they did, that certain types of physique, certain types of colouring, had better responses to medication. They actually had more proving symptoms when they took the substance to the point of developing symptoms. So blonde, fair-haired, gentle Earth Mother type women had more reactions to pulsatilla as in the provings, and they responded better to the prescription of those pulsatilla in diseases than other people. A Nathan Muir type of person who's much more closed up, doesn't communicate their symptoms very much, gave more symptoms when they took salt to the point of developing symptoms. But also that type of person responded better to the prescription of salt, Nathan Muir, for their diseases. So these are physical types, and it's quite important to establish these physical types. The sepia patient, for example, has very clear characteristic physique in most cases, and responds much better to that. So if you can establish the physical type of the patient, that is a help to the diagnosis. It's not the be-all and end-all, it's a help. These are the reactive modes to the patient, to the environment. Are they a hot person? Are they a cold person? Do they wear more clothes or less clothes than the person next door? Is this child always wrapped up, and is this one just always stripping his things off? Do they have a diurnal rhythm? We mentioned earlier on that arsenicum and mercury have a tendency to problems at night, and there are other patients who have a tendency to problems during the day. How do they react to climate? We've mentioned, I think earlier on I heard, or somebody here was talking about thunderstorms. There are people who respond badly to thunderstorms, and other people who are lit up by them. They love seeing the lightning and the thunder. And other people dive under the stairs and pull a pillow over their head and are frightened stiff by thunder. Are there arthritic pains better for warmth and better for warm weather, or are they paradoxically better in rain? Most people, I think, even conventional doctors now will agree that people's arthritic pains, back pains, joint pains, more often than not are worse when the barometer is changing or when it's actually wet. But there is a small group of people who are better in rainy weather, and it's quite a clear characteristic difference. Snowy weather is another thing, and which is very strange, but it's in the books. How do they react to their immediate surroundings? A hot room, a warm room. Very often the pulsatilla type patient at a party will be found near the open French window, holding a glass that she's not drinking from, because she's worse inside the warm room and needs to be cool. And these are things that are helpful. Some patients who are in their fever are in bed. They need to be warm, covered up, right up to here with a duvet, double duvet. Got the window wide open because they need their heads cool. Great, and if you see that, again, you can note that down as you walk into the bedroom. Reactions to food. Are they sensitive to coffee? Are they sensitive to oranges? Can they eat eggs? Are they made upset? And there's a whole range of foods which are important in actually setting pointing towards a diagnosis of a remedy. You must remember again, we're always pointing towards the diagnosis of the patient in homeopathy as in terms of a remedy, although we must always still have a clinical diagnosis for prognosis. Changes in the reactions since the onset of the illness are the most valuable. How does this illness affect the patient? I've touched on this before. Changes due to the illness in the way the patient's thinking, acting and being. They can be the most open, loving person in the world when they're well, but when they become ill, they change. And if you're looking at the prescription for the remedy, it's the change since the onset of the illness which are the most valuable. Sepia is a remedy in particular which manifests itself in illness. The woman or the man becomes exhausted, they get characteristic physical changes in their face, they're weary. In the ladies, very often there's a sensation of dragging in the pelvis. There's an aversion to family and friends. They withdraw. They can become very irritable, snappish. Whereas when they're well, they're fine, but they go into a sepia state, which is diagnosed on the changes since the illness. We tend to think, you'll hear that sepia is very often a woman's remedy, but I have an ex-SAS major who responds very well to sepia, and he's far from feminine. Taking the mental history, you ask, of course, and observe their mood. If you have a woman sitting on, or a man sitting on the edge of the chair with their hands in front of them, sitting bolt upright, you know you have somebody who's uptight. If they flop into the chair and say, "Oh God, I'm so tired, I can't even be bothered to do the important things in my work," you have a different type of mood. Fears and anxieties are very important. What are their fears? Are they worried about their health? Are they frightened of the dark? Are they worried about being robbed? Are they frightened of thunderstorms? It's an environmental thing, but it still comes in fears of anxieties. And in the repertory and in the materia medica, there's a whole range of fears which can be expressed and looked at. Fears of mice and insects. How do they look on their future and their past? Are they desperate? Do they have hopes for the future? Are they désespoir, despairing? Do they have, as my patient had, suicidal thoughts? All these things are part of the history that you should be looking at. We've mentioned earlier on today the fastidiousness, the tidiness of the arsenicum. There are other fastidious and tidy remedies. Nux vomica is one, pulsatilla is another. There are quite a number, but of clearly defined remedies that need tidiness. Are they the sort of person that going to somebody else's house will adjust the picture? They need it to be secure, plumping up other people's cushions. And is there a fear of infection, a pathological fear of infection that leads them to scrub everything and scrub their hands and scrub the sink and keep everything really clean and tidy? Children, is that child always washing its hands? In the minute it gets it dirty? You know, most kids will actually wallow in dirt, but there are other children who will wash their hands every time there's anything on them at all. Are they sympathetic? Will they give the person their shirt off their back? Or is there cuddling up to mummy, not cuddling mummy, but soaking up affection from mummy? The pulsatilla child needs to be cuddled. But when it goes to mummy for a cuddle, it's not cuddling mummy, it's sucking it out of mummy. Whereas the phosphorus child will go and give mummy a cuddle. There's a world of difference between the way they feel for others. Is it their own security they're looking for, or are they genuinely giving love? Speed of movement and response. I mentioned earlier on that the Gelsemian flu is a retarded sort of situation. They have the fever, they have the legs, the aching legs, but they're totally retarded, they're half-lidded. But also gelsemium is a useful remedy, for example, for exam and stage fright, where their minds go blank and they're totally retarded, they can't think, they lose the words. So a range of responses there that you can be looking for in your history taking. Are they confident, self-confident? Or again, there is in the repertory there is a rubric, lack of self-confidence, and there are remedies associated with that. So how confident a person are you in your job? How do you perform is a good question. To see whether they, well, people, that lady whose history I showed you, people see me as self-confident, but I'm so knotted up inside, it's incredible. Quickly now to the end. The mistake is to look for a total similarity of symptoms. You're looking for characteristic symptoms to compare against the materia medica. And finally, a comparison between the classical history and the homeopathic history. The classical history, which we discussed earlier on, takes account of the diagnosis, but the homeopathic history is patient-specific. We look for general and physical signs, but with our homeopathic history, we look for the modalities, the adjectives which describe those symptoms. In the classical history, you look for functional signs, but in the homeopathic history, you're looking for general sensory behavior, desires and aversions, non-psychiatric mental symptoms. Etiological signs are important, but here in the homeopathic side we look for the circumstantial causes, never well since. The disease diagnosis, in homeopathy we look for the diagnosis of the homeopathic matching remedy, and in homeopathy we look to the specific stimulation of the organism as opposed to antipathic or substitutive therapy. Thank you.